Hi, my name is Annika Vuppala, and I am running the National Outreach Campaign for CanSER.org, and I'm speaking here with Washington Representative Kristine Reeves.
Hi, Annika. Thanks for having me today.
Yeah, thank you for being here. So, my first question for you was really I just wanted to get a sense of what you think emotional support is like for cancer patients right now, and why do you think that that's important?
Well, so Annika, what I can tell you is that my family has a history of cancer diagnoses. My grandma was diagnosed in the late 70s, and thanks to the support of places like the Mayo Clinic, she got that emotional support and that medical support she needed. My mom recently passed away from lung cancer and had also breast cancer. Emotional support, her experience was very different because she lacked that emotional support. So, I've seen firsthand that when people are dealing with, a life altering medical diagnosis, you know, it is, they need everybody around them, their care team, their friends, their family, their community. They need everybody to wrap themselves around that person and really lean into the emotional support to help them get through it. And I think the key difference is that when you see emotional support present, you see healthier outcomes, right? I don't know that for sure in the research, but I think you see healthier outcomes. And for folks who experience a lack of emotional support, I think you see, less resilience, less, opportunity to rebound from the disease. And so I think the importance of emotional support is ensuring that everyone has access to it through our systems, through the processes of healthcare, and making sure that everyone has the best chance to succeed in recovering from cancer.
Yes, thank you so much. Thank you. Thank you for sharing about your mom also.
Yeah.
Um, I wanted to know a little bit more about um, how does your role as kind of a state representative, what is your role in determining the support that's available to patients and just in healthcare in general?
Yeah. So, at the micro level, I don't sit on the healthcare committee, so I don't have a day-to-day influence on the decisions being made around the healthcare system and its health and well-being, or the cancer care decisions. But as a state legislator, what I do have influence over is partnering and collaborating with my colleagues to prioritize cancer care as something that we care a lot about. And here in Washington, one of the ways that we do that is that we directly tie the tax revenue that we generate from things like tobacco sales, vape sales, et cetera, things that we know have cancer causing effects. We tie the revenue generation from that directly to combating cancer through cancer research, cancer care, cancer support. And so, as a legislator, I get to vote on budgets that say that making sure that things like emotional support, making sure that the healthcare infrastructure is available to citizens in our state, gets prioritized in how we spend folks' tax dollars. And I think that's one way that we can ensure that these efforts are stronger for everyone in our community.
Yes, thank you. That's so interesting. I didn't know that, so that's good
Yeah.
to know.
Yeah, we
Um,
actually we had a senator, his name was Andy Hill. And if you're familiar with it, we have something called the Andy Hill Cancer Research Center here in Washington.
yeah.
And he was a strong advocate. He and Senator-elect Harris, also a strong advocate, make it very clear that if we're going to sell a product in the state of Washington that we know, you know, causes cancer, we should be
Mhm.
directly correlating that revenue generation to helping prevent cancer. And so it's really great to see legislators who, on both sides, Democrats and Republicans, who are advocating for that kind of important work.
That's great. That's great to hear. My next question for you was I wanted to know a little bit more about what you think the current state of cancer support and cancer care is here in Washington. And like, what do you think about that?
That's a great question. I mean, I think I'd be intrigued to hear from your listeners. And, part of my job as a legislator is to listen and to seek feedback. And because I don't sit on the healthcare committee, I maybe don't get to hear as directly from community or constituents about what they think the state of emotional care is here in Washington. So I would love to open the door to your listeners, to your viewers, to your audience to say, reach out to me, please. I'd love to hear more as somebody who has, a family experience going through this. It's it's not only emotional for the cancer patient, it's emotional for the friends and the families and the sons and the daughters and the moms and dads. And I would love to hear more about what other folks think the state of emotional care is. I'm really lucky that I recognize the level of privilege I had to be an end of life caregiver for my grandma when she passed away from cancer. I recognize my privilege in being able to, from a job that I love, to be able to step away and support my mom in her end of life caregiving from her lung cancer. That is not a privilege that everyone has, right? And so, how do we make sure that you're helping legislators and leaders like me understand what would make that job easier? What would make providing those supports more accessible to everyone? And ultimately, with the goal of ensuring that everyone has equal access to that care so that they can recover to, and rebound and be resilient in a way that beats cancer. That's the ultimate goal.
Yes, I think that's a perfect tie into my next question.
Okay.
Um, I want to talk a little bit more about my national outreach campaign and kind of what I'm advocating for. Just like you were saying, increasing the accessibility of care and making it as accessible, but also as comfortable and sensitive to the patient's situation as possible is
Yeah.
my number one goal. And kind of with this national model with local chapters, that's kind of what I'm hoping to achieve and what I'm hoping to unite all of these existing orgs to create. And so I wanted to know a little bit about why are you supporting my mission? What do you think about it?
Well, what I love about your mission is at a time in our society, in our history, in our community culture, where it is so easy to be siloed, where it is easy to live in echo chambers focused on the division that we all face. What I love about the mission that you're presenting is it's really it's really about how we bring these organizations, these operations, these programs together in community and in collaboration to tackle our common mission, which is to end cancer in the United States and specifically here in Washington. And I know that's something I can get behind. I think it's something, I'm a mom of two young kids. I want to make sure that my kids live in a cancer-free future. And so I'm really excited about the work you're doing and look forward to continuing to support you and the organization moving forward.